I mean, I can start quickly, probably also with, the re-event rate, which is still quite high among ischemic stroke patients. So we managed to reduce mortality after stroke. So acute treatment has improved over the last decades tremendously. However, for secondary prevention, we still have a way to go. And secondary prevention largely depends on underlying stroke etiology. So depending on what the reason of the stroke is, obviously, we treat them differently. And the identification of underlying stroke is not that straightforward and simple. In the past, we used usually, or we're still using, the so-called TOAST classification, and to kind of identify underlying stroke etiology or the most probable cause of stroke. And the problem with the TOAST classification is that about 30% of patients, we really can't identify the underlying cause. And in addition to that, there is also the problem that there is a large overlap also. So if you have a large atherosclerotic burden, you also have cardiac disease, and that doesn't exclude each other directly. The thing is that in the last decades, there were also, strategies to improve classification, and the term ESUS, for example, was proposed to identify those with embolic stroke of unknown source. So to address those patients who seem to have a proximal embolization cause, but we're not sure where exactly it comes from. But studies in the past have identified that a large proportion of those with ESUS do have underlying atrial fibrillations or a cardiac cause of stroke. And therefore, the so-called ESUS trial were undertaken, where they looked at if those patients with an ESUS, so a stroke of undetermined cardio-embolism, if these patients are benefiting from oral anticoagulation versus antiplatelets. But as we all know, unfortunately, these ESUS trials were neutral. So they didn't really, the whole of them didn't really benefit from oral anticoagulation versus antiplatelets. And this is, again, kind of pointing to the issue that we need to better select our patients. And how can we do that? And I think one of the major advantages of modern medicine is that we also can look for underlying disease even in the absence of structural changes, and biomarkers, specifically blood biomarkers, can help here to identify patients with underlying cardio-embolic stroke. And in the past, we looked for potential protein biomarkers, which could help us in a better classification and help us to identify those patients who might have an underlying cardiac disease. And we found specifically the natriuretic peptides that they have quite a good potential to identify those with an cardio-embolic stroke. There were several studies made to assess if these biomarkers are associated with known cardio-embolic strokes, but also if they are associated with underlying atrial fibrillation. And these previous studies showed really a high association with these endpoints. And specifically, my group and our group were interested in mid-regional pro-AANP. So this is the peptide, which is the precursor of atrial natriuretic peptide, and atrial natriuretic peptide comes from the atrium. So if the atrium is diseased, these levels are elevated. So the idea was that we looked at markers, as I said, of underlying cardio-embolic stroke, and we found MR-ProMP to be a very good candidate. And there are several studies for incidence atrial fibrillation and association. There are studies where we show, or others as well have shown, that there is an association with known cardio-embolic stroke. And further on, there is also association with newly detected atrial fibrillation on follow-up. And exactly these patients are probably the patients who might benefit most from oral anticoagulation. So we can kind of select those patients who benefit most based on these biomarkers. And I think that's really a very interesting line of research, and I think it's also in line with the so-called precision medicine approach, where you really identify, select patients on the underlying pathomechanisms and then try to treat them best as possible.